Dr. Bill Adams here, and this is No Spin Live, episode 121. And do we have a great show for you today? We're going to talk about the patient checklist that is an FDA breast implant item of interest, as well as the non-surgical breast lift. And we got two incredible international experts to talk to you today. We have Dr. Anu Bajaj from Oklahoma City, just my neighbor to the north. Anu, how are you?
I'm great. How are you doing today?
Full throttle. So, and then last but not least, we got Dr. Jason Pozner from Boca Raton. Jason, we were just down in your neck of the woods in Miami, and you guys put up a great meeting for the Aesthetic Society.
Right, and Bill, just so if you guys don't know, Bill is our new president of the Aesthetic Society. Congratulations,
Bill. Very proud to be representing such an incredible organization, and you all, I know you all are both members, but the Aesthetic Society has been educating the top level of aesthetic surgeons now for 53 years, and it's been an incredible ride, and it's a great honor to be president. But
great group.
The meeting was great. It was our first live. It was actually the first live plastic surgery meeting, I think, big meeting in the country, and it was great to have it in Florida. Great to have it in Miami. Big success, and I think everybody enjoyed it. The only thing that I didn't get to do, Jason, is come to your house.
No. Well, the office.
meet the birds and drive in the Ferrari and that sort of stuff.
True enough. Next time.
All right. Well, let's get into it. So, Anu, I'm going to start with you. We're talking about the patient checklist. There was a new beauty article. There's been talk about this. You were at the FDA committee meeting a couple of years ago. You presented. It was a very interesting experience, and one of the things we heard was many of the patients that presented and patient advocates were desiring a checklist, a shorter version of the informed consent covering kind of the important items, and so that's been something that the FDA has talked about in their guidance. But kind of what are your thoughts on this and the article that we were reviewing?
So I think part of the issue was that a lot of these women who presented at the FDA felt as if they weren't adequately informed when they had their breast implants 5, 10, 15, 20 years ago. And so I think as surgeons, it's imperative that we discuss risks and benefits of surgery with all of our patients, because that's, I think, what led these women to demand a checklist. And the FDA has tried to comply. They recently issued the black box warning with breast implants, along with a huge list of things that you're supposed to mention to patients and things they're going to read. But that doesn't get to the heart of the problem, which is we really have to have a better way of educating our patients and making sure that they're appropriately informed before they have surgery. And I think that's what people are trying to do with the checklist, but I'm not sure if the checklist is actually accomplishing that.
Well, I think the checklist that was put out there was a checklist from Arizona. It's voluminous and complicated, and it's not going to be assimilated. There's been multiple studies on education and informed consent documents, and the longer they are and the more things people have to check off, they just start checking it off and they never even read it. So, Jason, I mean, the checklist, how long should a checklist be, and what's your viewpoint on this?
So let me turn it around on you, Bill. Bill, what did you have for breakfast yesterday?
Nothing.
So do you remember what someone talked to you about informed consent 15 years ago? No, I can't remember from yesterday. So, I mean, I think some of this thing's a little bit of a moot point, and I think a lot of the legalese is put in place for legal reasons and not for patient education reasons. So I think we probably need to separate that and keep things simple. A lot of times, the patients are very educated consumers and know a lot of stuff, and they ask you about minuscule data, and other times they're clueless and you need to read them in from day one on basic things. So I think it's difficult, and you have to read each patient individually, and certainly that they don't understand sometimes the full scope of what they're getting into. So it's our job to hit at least the basics, but I mean, like, do you go into detail about the potential what biofilm you might see in a capsular contracture patient 10 years down the road? It's some things that are just not relevant to informed consent.
Yeah, well, I think, and I think it's even a step further. What you're talking about, Jason, is that I think there's a differentiation between a checklist and an informed consent document. An informed consent document is longer and has many more pieces of information, but a checklist is short. Anu and I were talking before we started, and we were just saying, the checklists have been shown. Actually, there's a whole book on it called the Checklist Manifesto. My residents like to make fun about me about it because I talk about it, but it says everything in complex decision making can be solved with a simple checklist. But the operative word is simple,
Right.
and so the informed consent documents are one thing, but a checklist should be succinct. It should be very short, and it should have the absolute highline items on it, which is what you're getting at, Jason.
So
Anu,
Bill,
what's
one quick thing is, like, we actually talk about this in the operating room pretty much every day, because my anesthesiologist is a pilot and has a plane. And, it's like whenever my scrub tech forgets something, my anesthesiologist would say, well, where's your checklist? How come that's not on your checklist? How come the Bovie's not plugged in? How come the suction tubing didn't get in there? Why'd you forget this?
That checklist is more of a checklist about what you need to do. Like, did I mark my patient? Are my implants in the room? Do I have the patient's garments? Do we have an informed consent? Like, those are the checklists. And that's what the kind of checklist pilots use too, right? They have to make sure their plane's ready to fly. That's very different than a checklist for patients to say, did you know that implants can be this, are not lifetime devices, or implants may rupture, or implants may contain this. That to me is more of an informed consent, which then leads to what Bill and I talked to earlier. I think the patient decision aid that ASAP's put out this past year is actually far more useful in trying to convey that information.
But just to argue with you, if it was in an informed consent, if it wasn't a checklist type thing, that as you check it off, you didn't miss any boxes. I did discuss a rupture. I did discuss capsule contracture. I did discuss incision making, decisions on incision. So, I think it's got to be some balance, but the main thing is that we all agree on it has to be simple. Otherwise, you're going to get lost in the wording.
I agree.
Yeah, and I think the checklist that we reviewed, which was this Arizona checklist, is not well done. I'm not sure who the plastic surgeons were that collaborated on that, but I think that clearly, I'm sure, will be revised, and future ones are going to need to be simplified. And we actually have a group, collaborative community that we've worked on with several people that you all know, and this is what we're working on, trying to get. It's got to be a checklist. And I know you're right. It's different from, say, a flight safety checklist on a plane, but still, those are short and succinct, because you can't have a big long thing. It's not the manual. It's just like the most important things. And so that's, I think, what's useful. And it's just part of the educational process for the patient, which is integrated with informed consent. So there'll be a lot more on this, and this is going to be probably the start of a discussion we'll have many times. So hopefully we can make it simple. I always say, the more you understand something, the simpler it gets. And so I think that's the essence of a checklist. But let's totally switch gears. We're going to go clinical now. There's two articles. Jason, you sent one, and then there was another one that we saw, but there's been a lot of chatter recently about non-surgical breast lift. So Jason, let's talk about this. So can you get a non-surgical breast lift?
So let's talk about what the patients want, because pretty much every consult day, I see somebody with droopy boobs who say, I want perky breasts, but I want no scars. Pretty much that's every surgeon gets that every day, right? You guys?
Right.
And then your answer is, there's no free lunch. If they're pretty much droopy, you pretty much need a lift a surgical lift to get you up to where you want to be. So I think that's what we all understand, but the patients don't understand that. They're like, I want that, but I don't want a scar. Well, I'm not a magician, and that's the one thing that we need to talk to them about. But for mild lifting of breasts, there are some things that might give you a little bit of elevation of the nipple areola complex, such as subdermal radiofrequency, like Thermi or Body Tight. That's been proven to give you a little bit of a lift, but most of the patients that I see in practice need far more lift than that.
And you have to remember that those types of procedures are not going to give you that fuller, rounder look on the top part of your breast that a lot of women also want.
Right. So Bill, I heard Bill give a very good talk at, I don't know where this was, but you were showing the difference when people had a short lower pole, how if they were a little droopy, they filled really well with just an implant. So that to me is basically a scarless breast lift in the right patient that you measured given your measuring system beforehand. But to me, that's few and far between that do well with that. It was a physician patient that you showed too.
Right. Yeah, and that's definitely trade-offs and all these things. Probably just making sure patients have the right expectation. Anu, how do you kind of talk to patients that come in asking you about, hey, I heard there's a non-surgical breast lift. How's that conversation go?
Well, so my first goal when I talk to patients is I want to understand what type of look they're going after. Because if I can understand what they're hoping to achieve, because they can say the words lift or they can say whatever, but until you know the actual look, how they envision their breast to look, you don't know what they're wanting.
Yeah, they all want them up to here with no bra on. That's what everybody wants. At least in Florida.
Not necessarily in Oklahoma. And so I think that's really the first step. And then from there, I can explain to them what I can achieve and what I can't. And I do not have a skin tightening advice. And so this concept of a non-surgical breast lift doesn't exist because I do not have Renuvion or Body Tight to even accomplish that. But regardless, as we discussed earlier, most women are not candidates for just having a lift with one of those devices. They either need a surgical mastopexy with or without an implant, depending on what their goals are regarding how they want their breast to look.
I'm going to turn it around a little bit. In my hands and Anoop's hands and Bill's hands, our breast lifting has gotten far better over the last few years to start using GalaFlex mesh. Because when I go into that consult, I talk about the internal bra concept, and my lifts with implants are far better than they ever were because they really do stay up high when I have the support. Because when you're offloading the tension to a mesh instead of the breast tissue, those things really stay up nicely.
I think I also like to use the GalaFlex on a mastopexy without an implant for some women as well, because I do think that helps to maintain some more fullness, because otherwise if you just do a mastopexy without an implant, you do get some superior pole hollowing with time.
Right. I like actually do a lot of lifts with fat grafting to the upper pole. Yeah. I do that quite a bit these days.
I think that's excellent combo procedure. Well, I think that's some great information, and I guess it's buyer beware. If somebody's really touting non-surgical breast lift, you probably ought to make sure that you really know what they're talking about and really make sure that you're going to get what you're wanting if you're a patient. And I think that's going to be the most important thing to find out. If you like what you've seen and you want more information, you can see more of this on theplasticsurgerychannel.com.